Good afternoon, I'm Rob Boskamp, and you're listening to South Texas Midday. It's Tuesday, October 21st. Corpus Christi City Council meets today to continue talks on water strategy in meeting the challenges of industrial demand and drought. Joe Smikle summarizes the city's current water figures and projections.
According to city estimates, as of October 2025, Corpus Christi has 11.8% water capacity in its western supply, with current modeling projections showing the supply dwindling to 10% by December of 2025. Corpus Christi's western water supply includes Lake Corpus Christi and the Choke Canyon Reservoir System. The eastern supply relies on the Colorado River, where water is transferred through the Mary Roads pipeline to Lake Texana. Corpus Christi has a new drought contingency plan initiated this year titled Level 1 Water Emergency, which was previously titled Stage 4. According to current projections, Level 1 water emergency will occur in November 2026 when the western supplies are 0%.
In today's meeting, city officials will discuss spending $169 million to buy groundwater rights tied to over 22,000 acres north of Sinton, even though the city's own appraisal values the property at just $108 million. The meeting's full agenda and public comment session signups are available online at corpuschristitx.gov. And Victoria City Council meets today at 5 p.m. at the council chambers. On the agenda this week, they will have discussions for approving an interlocal agreement with the Golden Crescent Regional Planning Commission to operate Victoria Public Transit for fiscal year 2026 in the amount of $600,000. They will also hear more about appointing and reappointing of the Downtown Tax Increment Reinvestment Zone Board Chair. Also on the agenda, retired Public Works Director Ken Gill will have a water feasibility study update. The city of Corpus Christi is proposing to reuse about 1.5 acres of Sacky Park for an expansion of the Civitan Service Center. The proposed work would include building a chain link fence around the area to secure city assets and equipment stored near Sacky Drive. City officials told KRAS 6 News that over the years, the nearby operations center has experienced vandalism and other crimes. A project part of the city's 2025 capital improvement plan was originally estimated at $4.1 million, but that cost has been drastically reduced to $1.3 million. If approved, the project could move forward in September of 2026. Early voting officially got underway yesterday. On the ballot statewide are 17 proposed amendments to the Texas Constitution. In addition to local and state items, San Patricio County voters will have one item from the County Groundwater Conservation District. Proposition A is a proposed maintenance tax described as a tax increase at a rate not to exceed 1 cent per $100 of assessed property valuation. Several voting locations across the county include San Patricio County Elections Office in Sinton, Aransas Pass Civic Center, the Mathis City Hall Annex, and Portland Community Center. Meanwhile, Victoria voters can get their early voting done at the Patty Dodson Health Center at 2805 North Novato. A temporary voting location will also be available on the 30th and 31st at Bloomington Volunteer Fire Department at 51st 2nd Street. Last day of early voting is October 31st. In election updates, Ozzie Ochoa Jr. has announced his candidacy for Texas House District 37. The lifelong resident of Harlingen said he plans to utilize his 17 years of experience as an educator and a community leader as he prepares for the Democratic primary. Ochoa's priorities include education, public safety, veterans, women's rights, and economic growth. Meanwhile, Julio Salinas, a Texas legislature staffer and co-chair of the Hispanic Caucus of the Texas Democratic Party, announced last week that he has entered the race for Texas House District 41. He said that he plans to focus his campaign on making the Rio Grande Valley affordable for working families, strengthening public schools, and restoring trust in local leadership. Current District Representative Bobby Guerra has announced that he will not seek re-election in 2026. And while Texas had its first day of early voting for the November 4th election, yesterday a coalition of 14 states led by Texas asked the Federal Election Commission to amend voter registration forms. The states are asking it be changed to require that voters provide proof they're U.S. citizens. The charge is being led by Texas Attorney General Ken Paxton. The Texas Newsroom's Blaze Gainey reports Paxton says it's needed to prevent voting by people in the U.S. without legal status.
Paxton says the system's vulnerable because federal registration forms don't require proof of citizenship. Instead, it asks voters to swear they're a citizen under penalty of perjury, something Paxton called an empty threat. It's important to note that data shows non-citizen voting is nearly non-existent. Out of more than 11 million Texans who voted in the 2024 general election, only 33 names were flagged as potential non-citizens. It's not yet clear when the U.S. Election Assistance Commission will respond to Paxton's request. I'm Blaise Gainey in Austin.
Experts say Texas is still experiencing a teacher certification crisis. KERA's Bill Ziebel reports students could pay the price even after new state legislative efforts begin.
The latest numbers show more than half of the state's classroom teachers lack certification. They not only leave the field in higher numbers than certified instructors, they hurt students, says Bridget Worley with the education nonprofit Commit Partnership.
Students who are taught by uncertified teachers with no prior classroom experience lose 3 to 4 months of learning in reading and math.
Worley says the state's new education funding bill puts $187 million into a prep program so more qualified candidates can gain teacher certification. But the program will take time. The law requires all K-12 core instructors must be certified by 2030. I'm Bill Ziebel in Dallas.
Back in the Rio Grande Valley, Pharr's Valley View ISD is the first Valley School District to introduce electric school buses to its fleet. The district unveiled 8 electric school buses from Highland Electric Fleets at a ribbon-cutting ceremony last week. Interim Superintendent Monica Luna told MyRGV.com she hopes the buses will bring long-term savings, cleaner air for students, and a blueprint for sustainable infrastructure in the region. The electric fleet marks the first electrification project in South Texas and was possible through a grant from the EPA's Clean School Bus program. The San Benito School Board is closing in on breaking ground to build the district's first performing arts theater. Last week, the Valley Morning Star reported that the board selected Terracon Consulting engineering firm to run soil tests at Veterans Memorial Academy. Construction is expected to begin in March. Estimated cost for building the over 68,000 square foot performing arts theater is $21.1 million. And tests like electrocardiograms or a blood test for cholesterol offer good measures of heart health. But the American College of Cardiology is now recommending another test for a closer look at potential problems. In today's Vital Signs, Texas health cardiologist Dr. Tu Lei talks with KERA's Sam Baker about the blood test for HS-CRP.
CRP stands for C-reactive protein. It's a protein released by the liver anytime the body has any kind of inflammation. The HS stands for high sensitivity, which references the type of assay that is used to pick up very low levels of CRP. This is important because we know that atherosclerosis or plaque formation in heart arteries are due to an inflammatory process. And so if we are able to measure low levels of inflammation, we know that there is active plaque formation going on in the coronary artery.
Now, this is not a new test, correct?
It is not a new test. Historically, ACC has been sort of on the fence about its utilization, but there are more recent trials and studies showing clear links between inflammation and cardiovascular risk and death. And so this test has become more widely accepted as a tool and a marker for predicting somebody's risk. And some studies even show that it's equal, if not better, than using LDL cholesterol as a predictor.
At what point, though, do you ask for the HS-CRP?
The trend now is to do it frontline. If somebody is over the age of 40 and looking for risk assessment, or physicians see some predictive risk like they have hypertension, then it is a good baseline single test to order in addition to a lipid profile and measuring their blood pressure to come up with an overall risk assessment in terms of guiding how we are going to move forward in managing these patients.
Is this the kind of test a patient should walk into the doctor's office and ask for, be it during a physical or not, or is this something you want to wait until the doctor sees a need for and recommend it?
I'm all for patients being informed, and I think it's a good discussion to have with your physician, either your primary physician or cardiologist. But I think it's a decision that it's an easy test, but it's a test that I think should be left up to the provider with an educated discussion with the patients.
Once you know these risk factors, disorders, can you then start to minimize them or even eliminate them?
There's many things you can do to minimize inflammation. What we have now in our repertoire of medications is there's strong data to support statin therapies in reducing inflammation and reducing cardiovascular risk outside of LDL lowering. When you look at clinical trials with statins, even in patients who have normal LDLs, there has been a reduction in cardiovascular risk and death, mainly through the reduction of inflammation as measured by lowering the high sensitivity CRP. But what you can do outside of medical therapy is really focusing on lifestyle changes, avoiding high-fat diet, incorporating a lot of omega-3 in your diet, eating a Mediterranean or DASH diet with focus on legumes, less on carbohydrates, more on whole wheat, does reduce inflammation. Exercise is very important. If you smoke, smoking definitely is linked to multiple-fold increase in cardiovascular death through inflammation and unstable plaque. And sleep is very important as well.
Dr. Toulé is a cardiologist with Texas Health Hearst, Euless, Bedford, and with Texas Health Physicians Group. And that is the latest news and information on South Texas Midday. I'm Rob Boskamp. Your community arts calendar and more is on the way.